Okay, so I'm going to demonstrate to you some of the things that at least I try to do to make the result or create a result that could be outstanding. There's many factors beyond just stitching and things like that that play a role. How the patient's health is, how good they follow instructions, how good you provide instructions, and what kind of combination treatments that you do. In this particular case, I just did a pinch blepharoplasty of the lower lid. If you notice, we just had it less than 24 hours ago, and you can see she's a bit swollen, a bit red. But I'm doing what's called a thermi-smooth treatment, which is a radiofrequency treatment, because radiofrequency is shown to improve blood circulation, create new blood vessels, and create some smoothening, things of that nature. So I am doing this immediately after surgery, and I do this sometimes when I feel like I can get a better outcome depending on the patient conditions. In this case, I'm going to do it 3 times. I'm going to do it 3 sessions every other day so that I can improve her outcome, and I'll show you at the end of that first week how it's going to look.